Hi everybody, it's Q&A with Dr. J. Know Your Dental Cavities Part 2. This time I've got another cool model that I want to show you, share with you. But in order to do that, I'm going to have to extract a tooth. Now, who wants to see me extract a tooth on live TV? Everybody says it's really difficult, right? Sometimes you call it difficult things. Oh my God, it was so hard. It was like pulling teeth. It's not hard to pull teeth. It's so easy to pull teeth. No, it's not. It's hard. Make sure if you need a tooth pull, go to see your dentist. Anyways, we're digressing. We're going to talk about cavities. These are just dental models. Please don't try this at home. It is not as easy to pull teeth. I'm going to show you about cavities. So we're going to talk about first part. This is a healthy tooth, right? Or it's a model of a healthy tooth. And we're going to show you what it involves. I think I covered this on my part 1 visit where we showed everybody. Luckily, we have these models. And we can show, hey, the white part is the enamel part of the tooth. The yellow, slightly yellow colored part is the dentin. And of course, then you have the pulp of the tooth, which contains the nerves, which kind of tell temperature, hot, cold, and then the blood vessels, which supply nutrition and keep the tooth nice and healthy and strong. So a healthy tooth that everybody's maintaining very nicely kind of looks like this model does. It's nice, clean. Looks great, everything inside is healthy and in good shape. Now we're going to move down the line in the progression and we're going to take out model number 2, which actually has a tiny cavity on the top, or it may have a tiny cavity on the side. Now, you've probably heard this many times at your local dental visit, or with us, or maybe not with us, depends on where you go. They say you've got a cavity in your mouth. And usually, you know, it's like, hey, do you floss? Do you brush properly? You've got deep grooves. Maybe they recommend sealants to prevent these kind of cavities. Maybe you did the sealants, maybe you didn't. I don't know. But to kind of give you an idea, if you're not flossing enough, this is the contact area where the plaque that accumulates from your food collects and kind of starts to rot out the tooth and damages the tooth a lot. This is the top of the tooth where if you're not brushing properly twice a day, maybe more depending on your situation, then you get small cavities like this. As we are going to open up this model, it kind of tells you the cavities that's staying within the enamel part of the tooth, which is the white part on the side or on the top, can be easily restored by cleaning it out and repairing it and filling it up with a dental material under the right conditions, and the tooth is restored and it can last you a nice long time. If not done properly, sometimes it can deteriorate faster, or let's say if you're a bruxer or clencher grinder, you may or may not wear a night guard, or you know your diet doesn't allow it and then the bonding doesn't last. But usually cavities like these, bonding is done. A filling, as you may already know in simple terms, lasts a nice long time, does a nice job. All right, coming back to our third dental model where we have procrastinated maybe a little bit and the cavity's gotten a little bigger, a little deeper. And let's find out what that looks like from this dental model. All right, so we've got obviously a bigger hole. So let me put it in for comparison. You know, there's different sizes. So tiny, bigger, tiny, bigger. All right, so we're gonna focus on this bigger one. Let's take a look at this. As we open up this model, this bad boy's gone a little deeper into the tooth. Not only is it gone into the enamel, it's kind of gone into the yellow dentinal part here and here as well. And now it's kind of looking, you can look in the pulp chamber where the pulp chamber is starting to turn a little red. It's like an angry red color, where it should be a nice pink. Well, you don't normally see inside, so you can't tell if it's pink or not, but you have to take my word for it. But essentially, this dark red color signifies that the infection is into the nerve of the tooth, and now the tooth may need more involved work, more invasive work, like a root canal. So hopefully we see you before your cavity gets to this stage. Sometimes it's hard to say, though. Sometimes you just don't know. You know, sometimes your threshold of pain or discomfort might be so high, you know, things might get worse before you know it, and by the time you get to see us, you know, we may be catching this happening. Sometimes you may pick it out if you have symptoms, a little bit of cold sensitivity or a little bit of hot sensitivity, whatever you're going through, whatever you're experiencing, come in, talk to us. If it's simple sensitivity, it can be treated by a filling, some kind of desensitizing agent. You've heard of Sensodyne. There's better products that we have that we can recommend to you. But of course, if there's an infection in the tooth at this level, you definitely need a dental visit so we can take care of you. Okay? All right, let me show you the last one, which is this guy right here. Big one. Ooh, nice big one here. How about that? Let's see what's going on here. Wow, right? It's like an iceberg, right? It's like a small opening here, and you open it up and the whole thing inside is blown out. And sometimes patients don't know about this because they don't realize that once the bacteria kind of burrows through the enamel's really hard. And sometimes people say, hey, you know, it's just a small cavity. Nothing is small, because once it burrows through, it just kind of blows everything out from the inside, right? Sometimes you don't have pain, sometimes you do have pain. So if you get to this stage, rest assured your whole pulp area, this whole red area versus the pink it was in the previous models, kind of signifies that, you know, infection is severe, things have gotten bad, you may be in severe pain, or you may be having an abscess, and definitely there's more involved dental work needed, you know. So if it gets to this stage, yep, we're gonna be becoming best friends. Kind of tells you and gives you an idea about, okay, what's involved, how does a cavity start, you know, what are the, under what condition it starts, if you're brushing or not brushing properly, depending on your diet, if you're eating a lot of soda, if you're eating a lot of sugary foods, if you're not keeping up with your dental hygiene visits. Normally I recommend on average at least twice a year. Some people need 3-4 times a year or more, depending on your individual situation. So when you give us a call, we'll be happy to take a look at your dental hygiene. Take a look at your dental condition and pick out what is the right frequency for you to come in for your dental visits, for your regular cleanings. It may be 2 or 3 months, it may be every 4 months, or it may be every 6 months. Really is an individual. Everybody's mouth is different. Everybody's dental health is different, and it's completely customized for you. So gone are the old days of when you could say, oh yeah, just go twice a year or maybe once a year, you don't really need to. No, our diet has changed. We are eating a lot of processed and refined foods, and because our diet has changed, our dental care needs to kind of keep up with the times. And with the technology, it's super easy. It's painless, simple, easy visits that help maintain your teeth so you can keep your smile, keep your teeth for a long, long time, and enjoy the lifestyle, enjoy going to restaurants, being able to eat without having to worry about, oh, I can't eat that or I can't eat that, because there's limitations based on your dental condition. So if you have missing teeth, if you have broken teeth, if you have cavities in your teeth, if you know you need some dental work, give us a call. Our team members, our awesome team members, are ready and waiting to take your call and set up your first appointment and introduce you to some amazing world-class dentistry at Media Dental Associates, Bootway Dental, and Conshohocken Dental Arts. Again, guys, thanks for watching. This is Dr. J signing off. Until next month, have a great time.